Two members who were supposed to be here couldn't make it at the last minute for reasons beyond their control. So I'm going to channel them and talk about topics that I wanted the group to have some exposure to. But I may not do justice since it's not my work. So the first is Margarita Santiago Torres from New Mexico. And I did want her to point out the lessons that we can learn by studying Mexico. Mexico, after all, is progressive when it comes to taxes on sodas, since, as you know, they adopted in 2014 a 1 peso per liter tax on sodas for the express purpose of reducing the high rates of obesity and overweight in the population. And so the data that we have here, and I think there's a pointer here, the data comes from the equivalent, the Mexican equivalent of the NHANES in the US. So note, this is a representative survey done with 24-hour dietary recalls using a methodology similar to what's used in NHANES. And the right-hand bar of these histograms represents what the federal recommendation is for how much, in terms of the percentage of calories, Mexicans should be consuming from cereals, legumes, dairy, meat, fruit and vegetables, fats and oils. These 6 represent basic food groups. These last 2 sets are what they call discretionary calories. Where do you think they got that from? Now, as you can see, not unlike the United States, there seems to be a resistance to following federal recommendations when it comes to fruits, vegetables, and legumes, which are rich in fiber, rich in water, and low in sugar and saturated fat. But when it comes to fats and oils, they're pretty close to the federal recommendation. But when it comes to meat, they're clearly exceeding the recommendations. Cereals are about what's appropriate. But SSBs, sugar-sweetened beverages, are way higher than what the federal recommended limits are. Now, what I wanted to point out here was this, in my view, consistent inverse relationship between the consumption of the foods that are recommended and the consumption of sugar-sweetened beverages. Now, people in the past have said, well, it's just a halo effect. The more health-minded people both eschew the sugar-sweetened beverages and simultaneously gravitate more enthusiastically towards fruits and vegetables. But I'd like to throw out there the possibility that maybe there's some biological explanation why it is that the consumption of sugar-sweetened beverages or too much sugar from other sources might depress appetite for foods that are rich in fiber, rich in water, such as fruits and vegetables. So just a thought. So Michael Gorin was a co-author of the data that I'm showing here. And this is just a pilot study. It's observational. It happens to coincide with a hypothesis that I have. But this would seem to indicate, looking at mostly Latino, I think it was over 90%. So 47 subjects, adolescents recruited from the LA area. And so approximately a third were low sweetened beverage consumers on the order of less than one serving a day. And then there is a medium group of between 1 and 2, and then a high group of 2 or more. And what's interesting here is that this is sort of like a metabolic ward study where they were being evaluated repeatedly in the early minutes. This is in the later phase where they had a breakfast, a test meal, that was high in sugar or low in sugar, high in fiber, low in fiber. And so I'm focused on the later stage when they were allowed to eat ad lib. And what you see here is this fullness rating. It's common in the field when looking at satiation and satiety to use these visual analog scales, 100 millimeters, where you have on the low end not at all full and at the high end very full. I feel very full. It's one example. of an item to measure satiety. And curiously, the low consumers of sugary beverages score quite a bit higher across time with respect to their response to ad lib eating relative to these other groups. And I've just finished a trial involving 261 mostly Latino patients in Long Beach, and we used the same visual analog scale, and we looked at the relationship between declining sugary beverage consumption, which is what we had recommended, among other things, in terms of the dietary changes that the patients were told to adopt, and fullness. And we did find the expected inverse relationship such that as sugary beverage consumption declined, then reported fullness increased. So there is some suggestion that there may be a relationship between sugary beverage consumption and satiety signaling. And then finally, and this extends some of the comments that you heard from Jorge this morning with respect to what's happening in Mexico. And these are very recent data collected mostly by Mexican researchers, but you will recognize the name Barry Popkin here, who's been quite prolific in epidemiological studies, especially of sugary-rich food products. And they used modeling to project what the consumption level should have been in the absence of the peso, the 1 peso per liter tax. And they compare taxed beverages versus untaxed beverages. So the taxed beverages were the sugary beverages, including juices and sodas. And the untaxed beverages it included the artificially sweetened beverages as well as water. And what you find is that there's little difference between what was observed and the counterfactual volume that was projected by the model versus the taxed beverages. There is a difference that, in fact, expanded in the second year, in 2016, relative to, or 2015 relative to 2014. 2014 was the first year of the tax. Now, the magnitude of this difference, as Jorge said, was small. But nonetheless, it gives us some hope that there is a population-level impact of a policy such as the 1 peso per liter tax. So that concludes my presentation, my attempt at channeling Margarita Santiago Torres.